Hello friends, welcome back in the channel of Clinical Care Insight. We have started a series of lecture on the sensory system. Okay, and till now we already covered about basic definition of sensory system. Then we defined the meaning of sensation. Then we had moved ahead and we described about the receptor, type of receptor. Then in sensory system we divided, some are called the general sensation and some are called the specialized sensation. So our main emphasis on the specialized sensation. Okay, and then in the specialized sensation we discussed about the ear. Okay, then we discussed about the sensation of taste, that is mediated by the taste bud. Okay, then we defined about the nose. Okay, and today we started about the eyes. Okay, we will discuss about the eye. Hope you all are well and fine. Okay, so it is our lecture outline of today. First we will go with the introduction of eye, then the structure of eye, then talked about the intraocular pressure and related pathologies. Okay, related pathologies, because I feel it that when you are studying the normal structures, on that very moment if you touch the pathological parts, if you touch the pathology, related pathology, it is quite easier to understand. Okay, then it becomes quite easier to understand. So about the eye. Okay, that's why the world appears colorful, just because of the eye. Okay, the first thing about eye you should keep in your mind, and you came across in the textbook, that the ocular word is used in context of the eye. See, the ocular words comes from the oculus, a Greek word. Okay, oculus, which meaning is translated in English as eye. Okay, so basically it's a Latin word. Do you know the Hindi name of the eye? Or we can say the ancient, our language, that is Sanskrit. Yeah, that's called the chakshu. Chakshu, Nayan. These are some of the name of eye in our literature. That's a Sanskrit literature. So now we move ahead, and about the another thing about the eye is that these eye, how many pairs of eye we have? Yeah, one pair, that's obvious. One pair of eye we have. Okay, one pair of eye we have, and these eye basically they are present, or we can say they are protected. Okay, the eye is protected inside the very good, it is present inside the socket, that's called the eye socket. That is called the eye socket. These eye sockets is made up of by some of the bones. Can anyone name them, these bones? Yeah, very good. It's a parietal bone, then zygomatic bone, very good. Then yeah, ethmoid bone, very good. Then sphenoid bone. Yeah, ethmoid bone, sphenoid bone, and upper, that's called maxilla. They form the eye socket. Or basically we call it a cavity of the eye. Okay, cavity of the eye. Now let's draw one diagram of eye and proceed our study further. Don't forget, eye is the organ of vision. Okay. Now, see how eye is looking. Yeah, I know eye is the organ of vision. It's meant for looking, but like geometrically they are looking like a globe shape. Okay, they are looking like a globe shape. Okay, And one thing you know, that eye is one of the complex organ. Okay, why I'm saying it's a complex organ? Because their structure is complex. Okay, eye is a complex organ. Okay, it's also called the organ of vision. Organ of vision. Understood? Clear? Now, what we are discussing, we are drawing the diagram of the eye. Okay, and yeah, here is your lens. Okay, first I draw, then describe it. Covered, or we can say it's partially covered both the side, because this is an open eye. Is it good diagram? Perhaps it's a good. So these both they cover the eye. That's called the eyelid. So first you should know that eye is divisible into the two segments. We talked about the segments of eye. It is the two segment. The first one consists called anterior segment. Okay, and next one is called posterior segment. I'm talking about this portion, because half of the anterior portions, they are here visible. Okay, but these portion, half of the portion, they are not visible. So these portions which we see directly, that's called the anterior segment. Okay, and it consists of very good, it consists of 1/6 of total eye. 1/6 of the total eye. Whereas this posterior part, they consist of 5/6. Posterior segment consists of 5/6. Okay, and if we talked about their diameter is 25 mm, or we can say 25 mm is diameter of eye. Okay, and their shape, they are nearly a globe shape. Understood? Now move ahead and discuss this first part. The first part, as you are seeing, is your eyelids. We are talking the anterior segment of the eye. We are discussing first the anterior segment of eye, how eye is looking morphologically. Okay, so first thing we seen is our eyebrow. Okay, these are the accessory parts, so leave this. First, in the eye, they are the eyelids. There is the presence of eyelids. Their number is 2. Okay, their number is 2. But the main feature of this eyelid is that their function. Can any one of you tell me what are the function of the eyelid? Yeah. See, these eyelids, as you are seeing, first they help in the cut off the light. They help during the sleep, they cut off the light. They cut off the light. Second thing, when any dust they come in the eye, okay, they start a rapid blinking. Okay, blinking of eyelids. Okay, and next is helping the eye to produce the tears, or we can say helping the lacrimal gland more specifically to produce the tears. Okay, and in the eyelid there is a presence of their own some of the secretory gland, that's called the sebaceous gland. Sebaceous gland produce, it's produce the oily secretion, that's called the sebum. Okay, first I am talking their function, then I will go with their structure. See, cut off the light. You know that during the sleep you have to shut down this eyelid, that's basically a shutter of eye. Okay, so you have to shut down. Second thing is, if something comes in the eye, later on this lecture we will study that this portion that's called the cornea, it's a very sensitive. Okay, it's a very sensitive towards the light as well as the pain, temperature. So it is a very sensitive. Okay, so it provide their sensitivity is relies on the function of the eyelid. Okay, their sensitivity is realized on the function of the eyelid. Now, and these gland, basically these eyelids, they possesses gland which is called the sebaceous gland. They secrete the sebaceous gland, secrete the sebum. Now, the main thing we have to learn is related pathologies. Okay, related pathologies. You know that there are some person, I don't know you seen it or not, who sleep and their eye is open. I mean their eyelid is open. They sleep, okay, but their eyelid is open. This is a condition. Okay, this is a condition that's called the nocturnal logophthalmos. Write down. That's called the nocturnal lagophthalmos. This is not good for eye. Why? Because if during the sleep, if these shutters, that's basically your eyelids, they will not cut off the light, or we can say not close, then this part which is the sensitive to eye, throughout the night they are exposed towards the light. Okay, maybe it's a darkness, but they are exposed towards the external environment. Okay, so that can cause many things, but first thing is they cause irritation of the eye, okay, and dryness in the eye. Two things, irritation in the eye and dryness in the eye. That's the two things if these shutters will not close in night. But why this happen? This nocturnal lagophthalmos, why this happen? It's happened sometimes because these eyelids muscle, okay, these eyelids muscles, write down the name of the muscle. The first is called orbicularis oculi muscle. Second is your levator palpari superiorlis muscles. Two muscles, orbiculus. Talking about their structure, the first muscle is orbiculus oculi muscle, and second one is levator palpari muscle. Okay, now you know that our face, this area is supplied by the facial nerve. This is supplied by the facial nerve. So facial nerve, which is the seventh cranial nerve, they also supply the eyelid. Seventh cranial nerve. Write down. And which muscles? Eyelid is made up of the two muscles. The first one is called orbiculus oculi. Second one is called levator palparius. Okay. Now these orbiculus oculi muscles, they are supplied by the facial nerve. Okay, facial nerve. And you know that facial nerve have both the supply, somatic supply as well as the parasympathetic supply. So what happened, whenever this part, the sclera of the eye, okay, they got the sensitivity, they send the message through the trigeminal nerve, they send the message through the trigeminal nerve into the brain stem, okay, and brain stem, they send the feedback, we can say the feedback to the facial nerve, and these orbiculus oculi muscles, they are supplied by the facial nerve, they start blinking of eyelid. Because you know that this eyelid is a voluntary, okay, you can move by according to your own will, but most of the time they are involuntary, okay, and during the exposure of the dust, okay, or any particles, they start blinking by their own, we can say by their own will, okay, they are involuntary. So why they are involuntary? Because they are supplied by the facial nerve, okay, facial nerve, and the sympathetic, we can say parasympathetic supply, that's the facial nerve. Now facial nerve also have the somatic supply, as I told you, okay, and in these patients, the nocturnal legophthalmos persons who are unable to close their eyelid while they are sleeping in the night, okay, these nerves got damaged. That's called basically the Bailey palsy. So one of the reason is the Bailey palsy, Bailey's palsy, okay, the seventh cranial nerve got damaged, that's a Bailey palsy. Second is myasthenia gravis patient, okay, MG, myasthenia gravis, the neuromuscular problem, okay, that can also affect the person, okay, and they are unable to close their eye, and this is also age related, okay, it's also the age related, and sometimes it's genetically inherited. So what we studied till now, we studied that morphologically eyes appear like this, okay. First the eyebrow is present, the function of eyebrow is to provide the protection of the eye by the sweat, okay, and any other upper area of the dust. Then we seen that eye is we can say covered by the two membrane, that's called the first and second, these are the eyelids, basically these are the eyelids, the muscles which constitute the eyelids, which form the eyelids, they are called the orbiculus oculi muscle and levator muscles. Now the orbiculus oculi muscles, they are supplied by the somatic nerve as well as the parasympathetic nerve, and both are the part of the basically the facial nerve, okay. Facial nerve supplies the orbiculus oculi muscles. Sometimes what happens, due to the palsy in this nerve, okay, due to the damages of these nerves, the patients are unable to cover their eyelids while they are sleeping, okay, and that condition is called nocturnal legophthalmos, and it can be happened by them in the myasthenia gravis disease. It is age related and it can be genetically inherited. Understood? Now blinking of the eye, as I said, the facial nerve parasympathetic part, they also innervate this orbiculus oculi, but the blinking of eye is a reflex action. It's a reflex action. Write down, the blinking of the eye is a reflex action. Reflex action means there is a one arc, reflex arc. So what happened, the message from the sclera, okay, they go to the trigeminal nerve, okay, trigeminal nerves, and trigeminal nerves take this message and send into the brain stem, okay, brain stem, and brain stem via this facial nerve, they send message to the orbiculus oculi muscles, and the eyelids start blinking, that's called basically a reflex. So blinking of the eye during the exposure of dust is a involuntary or it's a reflex process. Understood? Now come to the other part. Tears, they help in the tears you know, like when these muscles, what are called the sclera is highly sensitive, okay, and it triggers the lacrimal gland to secrete the tears, okay. So blinking of the eye also stimulate the lacrimal gland. Now about the sebaceous gland, what happens sometimes when, like, when we have in the hand, we have the dust and we start like rubbing our eyes, okay, and generally what happened, there is we can say the lump formations in the eyelids, because you know that eyelid is, in the upper eyelid there is a 100 to 150 cilia is present. These are the cilia basically. So in the lower, the 50 to 70 cilia is present, okay, and in the upper 100 to 150 cilia is present, okay, and there is a follicle, this here the sebaceous gland is present, okay. We can say the base of the hair, there is a presence of sebaceous gland. So sometimes what happened, due to the rubbing by the dirty hand, okay, and maybe due to the blockage of the sebaceous gland, they lead to the lumping on these area, these area. Some of you felt this is like lumping, okay, redness, lumping, clump, we can say the clump formation. That condition is called eye style. The eye style. One of the most clinically, we can say, responsible bacteria is Staphylococcus aureus. So related pathology of the function of the sebum secretion and the cilia is the eye style, which is basically a lumping on the eyelids, okay, over the eyelids. And the most common bacteria, as I said, it is a very good Staphylococcus aureus. Generally their symptoms subside within a week, okay, but if it not, then there is a antibiotics which help in the relieving from the eye style, okay. These are the function of eyelids. So once again we have the two eyelids, okay. The function of eyelid is it's cut off the light while sleeping, okay, and when the exposure of the dust, they blink, okay. The blinking of the eye is basically a reflex arc, but the eyelid muscles are also voluntary muscles because they are also supplied by the somatic nerves, okay. They help in the tears production, they own process the sebaceous gland. And related pathology, that when persons are unable to close their shutter, that's the eyelid, while they are sleeping, that condition is called nocturnal lagophthalmos, okay. It can be due to the belly palsy, the myasthenia gravis disease, it can be the age related, or it can be the genetically inherited. Understood? About the blinking of the eye, sometimes what happened, due to the, we can say, the palsy, okay, or damages of the facial nerves, the patients are unable to open their eyelid, okay. That condition is called ptosis. Okay, understood? Now we move ahead, okay. And describe structure of eye. We already studied about the orbital of the eye, orbital cavity, because they are situated in the orbital cavity, which is formed by the 4 bones. The first one is your frontal bone, okay, then zygomatic bone, maxilla bone, sphenoid bone, and ethmoid bone, and lacrimal bone also, okay. They form basically the eye cavity, or we can say the eye socket. Understood? No problem. And in the eye socket, you know that they are attached, the eyeball is attached with the muscles, ocular muscles, okay. Eyeball is attached with the ocular muscles. Later on in this lecture we will discuss about the ocular muscles. For a while you just understand that eyeball is intact in the eye cavity by the ocular muscles, and between the eyeball, okay, between the eyeball and this ocular cavity there is an interdisposed adipose tissue, interdisposed, which provide the cushion to the eye, Now let's move ahead. Now once we described the eyelid, eyebrow, eye socket, now we discuss the wall of the eye, okay, the wall of the eye. Wall of the eye. See, the wall of the eye, they are divided into the three parts, okay, that there are three walls which is present in the eye. The outer appearance is called the outer wall, outer layer of the eye basically, okay. Then we have the middle layer of eye, then you have the internal layer of eye. The internal layer, or we can say the posterior surface, they are covered by the retina, okay, a neural tissue or neural sheath, that's your retina, okay. And the outer layer of the eye, they consist of the two layers, okay. The outer layer of the eye, they consist of the two layers. The first layer is called cornea, okay. The first layer is called the cornea, and second one is called the sclera. Cornea and sclera. The white portion of the eye is your sclera, and the black portion of eye is a cornea, okay. Cornea and sclera. Then middle layer, they consist of iris, okay, then ciliary membrane and choroid, okay, choroids. Understood? Now once again, the eyeball is made up of the three layers. The first one is called outer layer, second one is called the middle layer, third one is called the inner layer. The outer layer is the choroid and sclera, okay. Middle layer is iris, ciliary body, and we can say the choroids, okay. And the inner layer is the retina, okay. Now come in this diagram and mention those parts. Shall I rub this? Okay. But one thing I forget to mention about the conjunctiva, okay. Conjunctiva is a membrane which cover the sclera, okay. Conjunctiva is a membrane which cover the scleral portion of scleral wall of, we can say, the outer wall of the eye. And sometimes there also the inflammation happen. That condition is called conjunctivitis. It can be bacterial, okay, it can be viral, okay, and it can be allergens, okay. Due to the allergens it also happened. And about the bacteria, the Staphylococcus aureus, okay, and Staphylococcus pneumoniae. Write down Staphylococcus aureus and Staphylococcus pneumoniae. These are the two clinical bacteria which are responsible for conjunctivitis, okay. Then about the virus, the most common virus is adenovirus, okay. Adenovirus, and some of the foreign particles, the allergens, also can cause the conjunctivitis. Understood? Conjunctivitis, as you know, it's also known as the pink eye. Yeah, I have the pink color, pink eye, okay. I think you've seen the persons whom scleral portions, these portions, they become the pink, okay. Its condition is basically called the conjunctivitis, and because this membrane, this part, the scleral part, it is covered. Not only the sclera, the eyelid is also covered by Eyelid also called by the conjunctiva. Okay, this conjunctiva got inflamed, okay, or we can say the infected, and that condition become the conjunctivitis. Okay, and it can be due to the bacteria, it can be due to the virus, and it can be due to the allergens. The most important two bacteria is your Staphylococcus aureus, Staphylococcus pneumoniae, okay, and adenovirus and allergens. And one thing you just keep in mind, this is a highly infectious. It is a highly infectious because they produce some of the yellowish fluid, okay, some of the yellowish fluid which is infectious in nature, Now we move ahead and discuss in detail about the layer of eye. Eye is like, it's a very complex organ, that's obvious, but it's quite interesting. Okay, and I don't know why, but there is one saying called the complex things are beautiful just because they are complex. But I don't think it's a reality, because like sometimes the simple things, like the simple appearance, simple presentations, they attract more people as compared to more. You understood it, okay? So leave the part, we are discussing the wall of the eye. Okay, we discussed there are three walls present in the eye. First one is the outer layer, consists of the cornea and the sclera. Okay, second one is called the middle layer, consists of the iris, ciliary muscles and choroid. Okay, and the last one is the retina. Now first about the sclera. As I told, the sclera is a white portion. Okay, a sclera is a white portions and they are present in the posterior side. Okay, this is your sclera. It is present in the posterior side of the eye. Posterior side of the, the posterior side consists of the 5/6 part of total eyeball. 5/6 part of the total eyeball. Okay, if you know that the sclera is a white in color. Okay, so what about the histology? Simple, they are made up of the white fibrous tissue. Because they are white, so they are made up of the white fibrous tissue. It's easy to remember. White fibrous tissue. Okay, now the outer layer of eyeball, which present between the iris, okay, which present between the iris and pupil. Okay, iris and the pupil. Now the second layer is your cornea. The second outer layer is your cornea. About the cornea, this cornea layer is mainly, I think it is a highly avascular. Okay, it's a avascular, not a vascular. Write down, it's a avascular first of all. Avascular, and its refractive index is 1.736. It is highly sensitive. Now one by one we just understand. Okay, have patience. Now avascular means they don't have the blood supply. First of all, they don't have the blood supply. Their refractory index is 1.736. It means what is mean by the refractory index? Yeah, refractory index. Not okay, don't, no problem, I will tell you. The refractive index, it denotes how the light is passing by an object. Okay, is it refracted, deviated from their path, or it's go directly? Generally we measure the refractive index, okay, on the basis of vacuum. So here the refractive period is 1.736, means the light rays which is coming towards the eye, how much they are, we can say, deviated, that is denoted as a refractive index, that is denoted as the refractive index. Here is 1.736, 1.224 is a standard in the, I think in the vacuum, okay, in the vacuum. So most of the light which comes, they are very sensitive toward the light, okay. Their refractive index shows, refractive index is a basically, we can say, the property of a material towards the light, about the light, okay. So it's a 1.76. They are highly sensitive by lights, okay, pain, temperature, anything else? Yeah, okay. Now they don't have the blood supply, okay, but they have the free nerve endings, that is why they are sensitive, So what happened, we are exposed by a dust touches this cornea, okay, dust touches for the conjunctiva, then the cornea, the conjunctiva basically cover this area, your sclera, okay. The cornea is not, it's covered, but like it's covered by the partially, okay. So when dust touches this cornea, there is a generation of, there is a nerve ending first of all. So this nerve ending is for the facial nerve, for the trigeminal nerve. Send message, as I said previously, to the brain stem, okay, via the autonomic branch of facial nerve. They send message to the eyelid muscles, that your orbicularis oculi muscle, okay, we can remember by the OO, orbicularis oculi muscles, and there is a generation of the rapid blinking of the eye. Since it is avascular, so corneal, and it is also transparent, remember, there is no color of cornea. It's generally a transparent, but it's appear sometime as a blue, sometime as a, we can say, the red, pink, okay, sometimes black, because there are the other membranes inside the cornea. Like the pupils, okay, they are reflected in the corneal membrane. While we are seeing the cornea. So basically they are transparent. Cornea is a transparent, and it is also avascular. So corneal transplantation is very easier. Because it is a sensitive, so it is prone towards the problem. Okay, so corneal transplantation, this is very easy. This is also called the corneal grafting, okay, and it's also called keratoplasty. So till now we discussed about the first layer of the eye, that is cornea and the sclera. Cornea present in the anterior aspect of the eyeball, and the sclera is present the posterior part of the eyeball, okay, and it is a white portion of our eye, and it is made up of white fibrous tissue. That's easy to understand. Now about the cornea, first of all, just remember one thing: it is a transparent, okay, and it has the free nerve ending, and it is avascular. By remembering these three things, that it is a transparent, you just remember that it does not have any color, okay. So the refractive period, we can say the refractive index is really a high, that's 1.736, okay. They welcome most of the eye rays, okay. They don't deviate too much the we can say the light rays, okay. Then they have the free nerve ending, that means they are very, very sensitive towards the temperature, pain, and they send the message via the trigeminal nerve to the brain stem, and there is generation of the action, we can say the message, okay, which comes by the facial nerve, parasympathetic branch of the facial nerve. That's basically reflex arc. And because they are avascular, so corneal transplantation is easier. The transplantation is also called cornea grafting, as well as they are also called as the keratoplasty. So now let's move ahead and discuss the middle layer that consists of the eyelids, ciliary muscles and choroid. Now the first middle layer is consist of the choroid, okay, and choroid is a thin vascular layer, okay, choroid is a thin vascular layer, choroid is a thin vascular layer. This is your choroid, okay, and it is thin vascular layer. What is mean by the thin vascular layer? Means it have the blood supply, okay, it's have plenty of blood supply, because lots of blood vessels, blood plexus, okay, they are present in the choroid, choroid membrane of, we can say, the middle layer of the eye, okay. Now they provide the oxygen, nutrition to the, very good, your cornea, because they are avascular, okay. Cornea is made up of by the four layers basically of the cells, okay. The first one is called a stratified layer, so they need the nutrition, and that nutrition is provided by your choroid, okay. So remember, cornea take nutrition from the choroid, okay, understanding. Now there is a second ciliary body, these are the ciliary body, okay, and they are joined by the lens basically is held by the suspensory ligament. These are the ciliaris muscle, okay, they are the ciliaris muscles. We are talking about the middle layer, the ciliary muscles. First about the ciliary muscle is that it's help in the, we can say, suspension of the suspensory ligament, which ultimately help the lens to stay on a one place. Understanding? Now the second function about this ciliary body is that they consist mainly of the three parts, okay. You just write down the name. The first one is called orbiculus ciliaris, okay, second one is called the ciliary body proper, and third one is called the ciliary processes. Later on in the lecture we will study that they all help in the, we can say, the dilation of the lens and constriction of the lens, while they are adjusting, or while they are we can say, seeing the object, they help the lens, Once again repeat the name of these three muscles of the three parts of the ciliary body. The first one is orbiculus ciliaris, don't confuse with the orbiculus oculi, which is a muscle of eyelid, don't confuse with that, okay. So first one is your orbiculus ciliaris, okay, second one is your ciliary body proper, and third one is ciliary processes. Fine. Now the another part is the iris. Another part in the eye is your iris, okay. These extensions, they are the iris, and they are made up of by the two muscles, okay. One is called the constrictor and one is the dilator. The constricted pupillae and dilated pupillae. Constricted pupillae, okay, and dilated pupillae. These are supplied by the, very good, autonomic supply. They are supplied by the autonomic nerve, and they help in the constriction of the pupillae and dilation of the pupillae when the light fall into the pupils, okay, This is basically a kind of, we can say, curtain. It's basically a curtain. It closes, okay, constricted, and it's dilated. Understanding? No problem. Now come to the inner layer, that is the retina. Retina is basically we can say a neural sheath. Okay, it's basically a neural sheath, and the histology is quite complex. They are made up of by the 10 layer of the cell. 10 layers of the cell. So just listen, name, not need to remember all. The first one is the layer of pigmented epithelium. Okay, the first layer is the layer of pigmented epithelium, which contain the first is melanin. Okay, the first is called the melanin, which help in the absorbing of the light. Now second layer consists of the layer of rod and cones. Okay, third is your external limiting membrane. Fourth one is outer nuclear layer. Fifth one is outer plexiform layer. Sixth one is inner nuclear layer. Seventh one is inner plexiform layer. Okay, eighth one is ganglion cell layer. 9 one is layer of nerve fiber, and 10 one, which is the last one, is the internal limiting membrane. Okay, in all this retinal layer, we have to remember about the two layer more specifically. The first layer is the second layer basically. Okay, you have to remember the first layer, which you have to remember is your first layer, that is a pigmented epithelium. Okay, pigmented epithelium. And second layer, which is actually a second layer of the retina, that's called the cones and rod layer. Cones and rod layer. So today in this lecture I am not going into detail in the cones and rod, because we will deal with their structure in our upcoming lecture. Okay, but just you remember that the cones and rods is a actual cell for the vision. Okay, it's basically called the photoreceptor cell. It is a photoreceptor cell, or also called as a visual receptor cell. Write down, it's a photoreceptor cell. Okay, and it is also called visual receptor cell. Okay, these are both the neural basis of defining this corn, and we can say the cornea, cones and rod. Okay, and there is also a chemical basis. Do you heard of rhodopsin? Okay, rhodopsins. There's also a chemical ways to define the rod and cone, but their name is due to their shape. Okay, they appear as a cone shape, so they are called as a cones. They appear as a rod solid shape, they are called as a rod. And there are 6 million cones is present in your eye retina basically, and there are 12 million rods are present in your retina. So you are millennial as far as this rod and cone are concerned. You are millennial. Okay, now so the last part which we discussed today is our optic discs. Okay, mainly this part is called the fundus oculi, or fundus of the eye. So once again we discussed the wall of the eye. There are three layer, or we can say the three wall of the eye. Outer layer consists of the cornea and the sclera. The middle layer consists of the choroids, lily body and iris, and the inner layer consists of the retina. Retina further consists of the 10 layers, but we have to mainly focus on the first layer and second layer, that's the pigmented epithelium and cones and rods. Okay, move ahead and describe about the oculi, fundus oculi. Fundus oculi. Fundus oculi. Fundus oculi. Fundus oculi is basically present in the posterior aspect of the eye. It is basically present in the posterior aspect of the eye. This part is bit dilated. Okay, fundus oculi, these are called the fundus oculi of the eye. Okay, it's basically present in the posterior inferior portion of the eye. This is the posterior portion of the eye. If you are looking from here, this is the anterior portion, this is the posterior portion, so it is present mainly the posterior inferior part of the eyeball, first of all. Okay, and they consist of the two things. The first one is your optic disc, and second one is macula lutea with centena frontalis. First one is optic disc. About the optic disc is that here in the optic disc there is no presence of, we can say, rod and cones. So you know that the rod and cones is a photoreceptor cells. So if the rod and cones is not present, then there is no any image formation. There is no any image formation. That's why they are also called as a blind spot. They are called as a blind spot. Okay, blind spot. The second thing which contained by the fundus of the eyeball is macula lutea with central frontalis. Okay, macula lutea with the central frontalis. In the macular luteal part of the eye, okay, there is a very thin arrangement of the retina. Retina is here thin. Okay, thin retina. So whenever you are seeing the things, okay, like right now I'm towards you. Okay, I'm towards the camera. I'm seeing you. I'm towards you guys. Okay, so you know, like when I am looking at you, I am staring at you, this type of vision is mediated by the macula lutea, because the rays which is coming is directly focusing on this area. Okay, directly focusing on this area. Now this is responsible for this type of vision is called the acute vision. Okay, or sharp acute vision. This is a acute vision, because and the next things you are seeing, it's like sometimes it's like blur. Okay, but the main thing which you are focusing is due to this macula lutea. Okay, macula lutea. Understanding? Any problem? No? Shall we move ahead? Yeah. Okay, so macula lutea with the fovea centralis. Now this layer macula lutea, sometimes there is a degradation, lead to the blindness. The degradation of the macula lutea, okay, lead to the blindness, because here only you are able to form the image. Okay, here only there is a inverted image formed. Okay, but due to the degradation, and this degradation is basically related with the age. This degradation is basically this kind of blindness, we can say, is related with the age. The first one is called the dry age related macular degeneration, dry AMD. Okay, and second one is called the wet age related macular degeneration, AMD. Okay, understanding? Now I should be more specific in lecture. Okay, see, sometimes what happens, this macula lutea, okay, they start degradation, and mainly it's happened while we are aged. Okay, while we are aged. Now the thing which we have to remember here is that they are due to the dry age. Okay, AMD, we can say dry age related macular degradation, or it can be due to the wet AMD, means wet age related macula lutea. They have their own characteristics. And both both lead to the blindness. Both lead to the blindness of the eye. That's one of the cause. A person is aged, that's one of the cause for the blindness. Understanding? While they are called the wet, because here there's one term that's called the neovascularization. Neovascularization means generally the less blood supply is present in the macula lutea area, okay, but due to the pathology there is a formation of some of the underlying blood vessel, that's called the neovascularization, okay, and that's why they are called the wet age related macular degradation, lead to the blindness. Now the vision which is formed by the central frontalis, this is called as the name of the vision, the acute vision is called as a foveal vision. This is called as a foveal vision, okay, it is a foveal vision. Understanding? Let's move ahead. Once again summarize. Fundus oculi is present in the posterior inferior part of the eyeball. They consist of mainly the two things. The first one is called the optic disc. In the optic disc there is no presence of retina, or we can say there is no presence of rod and cones. That's why they are called the blind spot. Understanding? Then we have the macula lutea with central frontalis. This macula lutea is responsible for the central vision. They are responsible for the central vision, okay, and due to the degradation of this macula lutea there is a blindness, and basically it is age related. If it is due to the DAMD, dry age related macular degradation, that also lead to the blindness, and there are sometimes the neovascularization due to the some pathology. That condition is called as the WAMD, wet, okay, age related macular degradation. Understanding? And the vision which is mediated by the central frontalis, they are called the foveal vision. They are very sharp, the acute vision, okay, the acute vision. Now let's move ahead and discuss about the lens. We have lens. This is lens, okay, these are your lens. About the lens, it is a biconcave in shape. See, there is this portion is called the anterior pole, okay, and this is called the posterior pole, and the lining which join this anterior pole and posterior pole, they are called the optic axis. Okay, and the line which join the anterior pole with your this macular luteal, they are called the visual axis. They are called as a visual axis. When rays comes via this visual axis, there is an image formation, and when they come with the optic axis, there is no any image formation, okay, there is no any image formation, and they fall into this lens. Now this is formed by the biconcave lens, and they are suspended by the suspensory ligament. They are highly elastic. This is about your lens, okay. So we move ahead. Now we are going to discuss about the last topic of today, that's the intraocular pressure, okay, which is due to the intraocular fluid, mainly aqueous humor, okay, aqueous humor. Now we are discussing the intraocular fluid. Intraocular ocular fluid. These fluids are basically meant for giving the shape to the eyeball, because inside the eyeball they are hollow. Okay, so how they maintain their cellular integrity? They are maintained just because of this help of intraocular fluids. So there's one of the function is maintaining the shape of the eye, or we can say shape of the eyeball. Okay, now there are two types of fluid. Okay, vitreous humor and aqueous humor. About the vitreous humors, they are present behind the lens. Okay, vitreous humors, they are present behind the lens. Okay, they are present behind the lens in this area, and they are mainly consist of the albumin, okay, and hyaluronic acid. Okay, it's exchanged by the diffusion. Okay, now about the aqueous humor, okay, it is present in front of retina. These area they are by the aqueous humor, and here behind the lens there is a presence of vitreous humor. Vitreous humors, as I said, is consist of the albumin and hyaluronic acid, which is basically meant for maintaining the turgidity, we can say, or the shape of the eyeball. Okay, but vitreous humors, they have many functions. The first function, as I said, is the maintenance of the shape of the eyeball. That it maintain the intraocular pressure. Okay, then it provide the nourishment oxygen. To the rest of the, we can say, the layer of the eye, understanding, which are avascular. Then they remove the metabolic end product. But the main concern we have is about the intraocular pressure, which is mainly mediated by the aqueous humor. Now, the intraocular pressure, normally they are 12 to 15 mm, okay, of 12 to 15 Hg. Okay, is it correct? Let's check. Yeah, the aqueous humor 12 to 15. But what happened, due to this some pathology, okay, more than when 70 mm of Hg, not mm, it's a water, 70 Hg pressures become, okay, that condition lead to called the glaucoma. Okay, that condition is called the glaucoma. Understanding? No problem. Okay, there are types of glaucoma. There are 3 types of glaucoma. Okay, but the one thing you should just remember, due to the increase in the intraocular pressures, there is a problem in the optic nerve. That condition is lead to the glaucoma. Understanding? And person become the blindness. So glaucoma is one of the cause of the blindness due to the increase in the intraocular pressure. About the lens, you should keep in your one thing in your mind, that your lens shape is changes, okay, as you are growing. So mostly in the old age, the lens become, we can say, sometime opaque. Okay, that condition is called cataract. Okay, and sometimes their vision become impaired, or we can say the double visions appear. That's called the diplopia, and the condition is called presbyopia. Okay, diplopia. Understanding? No problem. So by this we are concluding our class today. we discussed about basic structure of the eye, okay, related pathology. We discussed about the intraocular pressure, okay. In the next lecture we will cover about how these light which fall into the retina, okay, they fall into the retina and there is a formation of the image. Basically we will deal with the visual process. And one thing more, initially as I told you that your eyeball is attached, okay, with the orbital cavity, okay, orbital cavity by the some of the muscles, that's called the ocular muscles. So, and ocular muscles, these muscles help the eye to move, spin, okay, and adjust towards the, we can say, the objects, okay. So we will, in the next class we will deal with the two terms, we can say the two phenomena. The first one is your muscles, ocular muscle, okay, and then we will also deal with the structure of the rods and cones, okay, and then at last we will deal with the how this image formation happen, how we are able to see the things, that's called the visual process. Hope you understood today class. So thank you with having me. Bye, have a nice day.